Today we introduce the fully anatomical articulator, and in this case the Denar. This type of articulator most closely simulates the movements directed by the anatomical occlusal morphology. This class of articulator will accept a hinge axis kinematic transfer bow or face bow record. The incisal guidance can closely simulate the paths of the natural dentition. This class of articulator is fully utilised in extensive restorative procedures as well as diagnostic determinations of temporomandibular joint dysfunction, TMJ.
For Denar articulation, we must transfer the face bow record to the articulator by means of a transfer jig. Initially, the articulator should be set to arbitrary positions with the internal angle set at 5 degrees, the condylar angle at 30 degrees, and the incisal guidance pin set to 0. Once locked into position, no lateral movements will be permitted. We remove the white plastic incisal table and move the transfer jig into position. In this instance, the face bow record is fixed in the transfer jig, so that the occlusal table is in the correct position for the condyle heads of the articulator. Once everything is in place, we must ensure that all locking screws are firmly fixed into position. With the Denar articulator locked and the face bow in position, we score the bases of the upper model and align the teeth into occlusal bite registration. In order to maintain this positioning, a small amount of sticky wax can be used. The upper model on the articulator should be moistened to prevent it from absorbing excess liquid from the plaster of Paris. We raise the upper arm and plaster is added to the base of the upper model, with excess plaster added to the plastic mounting plate on the Denar articulator. We then lower the upper arm until the incisal pin touches the incisal table. Excess plaster will be pushed out, and this can be rough trimmed with a plaster knife to make it level with the sides of the model and the articulating plate. The plaster can then be left to set. Once the plaster has reached an initial set, we can use a plaster knife to smooth any rough edges, using the edge of the upper model as a guide. We can use wet and dry paper to smooth the plaster further. Before we attach the lower model to the upper model for articulation, we must score the base of the model. This is to allow relocation if the model dislocates from the articulating plaster at a later stage. We must ensure that the bite registration elements are firmly attached to the lower occlusion, and remove the face bow registration from the upper model on the articulator. In order to do this, we must first remove the transfer jig, replacing it with the white incisal table of the articulator. Turning the articulator upside down, we moisten the lower cast in order to attach the lower model to the articulator. We apply a prepared mix of plaster both to the base of the lower model and to the plastic articulating plate that's attached to the lower limb of the Denar. With sufficient plaster between the lower model and the lower limb of the articulator, we lower the limb until the incisal pin touches the incisal table. This will push any excess plaster out towards the side walls of the lower model. Again, using a plaster knife, we smooth and trim the plaster into a smooth state and leave it to set. Once the plaster has reached a state of initial set, we can finally trim the excess from the side walls of the lower model and smooth the plaster towards the articulating plate on the lower limb. We can then use wet and dry paper to give a final smooth finish.